Emily Jury's licensed clinical mental health counselor. This here is Manny, who will be joining me today. So for this episode, I'm going to be talking about starting therapy and the possible hesitation or nervousness that can come with that. These videos are certainly not going to replace professional help. So for anyone out there who's maybe been a little ambivalent or hesitant or just outright fearful of starting therapy, I'm hoping this video might help give you some comforting perspectives, and I'll also provide some specific strategies to cope with that nervousness. So for starters, there's a good amount of people out there that are fortunate enough to have some pretty great support from friends and family, and so they often wonder, why do I need support from a therapist? I already have support from friends and family. And so I wanted to clarify that. So support from friends and family often looks more like them maybe kind of like feeding and fueling our emotions, but that's to kind of like support and validate how you're feeling, saying things like, yeah, that is such a jerk move, or maybe from friends and family, you might want some specific advice or their perspective on what to do. Like, should I text them today? Should I wait a few days? Right? But support from a therapist is different because one, we have no preconceived perspectives on you or the people around you. Two, we allow space for all emotions, but also help to relate with these emotions in a constructive way. And three, we don't actually give any advice. So we might give you certain practices or possibly alternative perspectives that could be hard to find, but we don't actually give advice on like what decisions you make or actions you take. We're the experts on mental health tools and strategies, but you're the expert on yourself. So we're more like guides as you make the actual moves. Hopefully that kind of gives you a little bit more perspective and clarity on like what therapy is and isn't. Now, it's really common for people to feel some level of concern, nervousness, anxiety, or downright fear when considering therapy. And the reality is you do typically talk through the hard parts of your life, and that inevitably has some unpleasant emotions and experiences that come along with it. Maybe tough things like loneliness or sadness or anxiety or shame and other unpleasant emotions. So it's understandable that you might have an instinct to avoid this unpleasantness. It's kind of in our nature to say, no, I don't want to feel that. I don't want to go down that road. So one thing that's an important part of training as a therapist is that we try to guide the conversation in a way that can titrate in the challenging stuff, but avoid feeling flooded and overwhelmed by unpleasantness. So we kind of help feel some of the tough stuff, but make sure that we're doing it at arm's length, right? And doing it in a way that can be a little bit more comfortable. So when you think about it that way, therapy can often actually be like the safest environment to deal with unpleasant emotions, since we're kind of trained to help take them on, but in a way that's doable and not overwhelming. As you'll probably learn on this channel and in therapy yourself, actually feeling unpleasant emotions in a safe way is really important to your overall quality of life. And so that's actually going to be my next episode, is kind of clarifying that connection of why feeling unpleasant things actually improves quality of life. So for today, I'm going to give you some specific strategies for the emotions that you might feel regarding therapy. So if you have some concern and nervousness around starting therapy, but you're still proceeding with it, you're still finding a therapist, getting it scheduled, then there's not too much work that needs to be done there, because you're actually still planning to follow through with your goal and following through with that goal and intention. So you might just kind of say, oh, hey, nervousness, I see you, I feel you, I appreciate you looking out for me, but I'm still pleased with my choice to pursue therapy anyway. And the behavioral coping strategy that you can think about for today, which will be a somewhat common one for when we need it. It's kind of just acknowledging this nervousness, but then refocusing on a task that's in the present. So if you're not currently in your therapy session, then you don't really need to be thinking too much about it. So you can acknowledge the nervousness and then refocus on whatever you're doing. Maybe you're reading, maybe you're watching a show, maybe you're working out, maybe you're playing a game. So refocusing on what's in front of you. If you have a level of nervousness, anxiety, or fear that's actually keeping you from searching for or calling or scheduling therapy or showing up for that first session, that's when we might want to do a little bit more work and use a cognitive strategy there. Because a part of you is wanting to pursue this goal of therapy, but these feelings and emotions that we're trying to escape are keeping us from doing that. So this cognitive coping strategy is essentially like what you might say, like playing through the image or playing through the worst case scenario of what's going on. So there's 3 questions that you'll ask yourself. So 1, what am I most nervous or anxious or fearful about? And then you take time to answer that. 2, if that were to happen, how would I handle it? What would happen next? What would it actually look like for that to happen and how I would handle it? And then 3, is that something I can handle? Maybe a lot of times we realize, yeah, maybe there would be a level of unpleasantness or discomfort, but maybe that is also something I can handle. And maybe the possible benefits of starting therapy outweigh that unpleasantness or other concerns that we might be worried about. And so that's it. And so you kind of see how you're feeling after you've thought through those three questions. And maybe, with thinking through those questions, maybe there's just enough wiggle room after that to take that next step. And as you might have guessed, these 3 questions can actually work well for a variety of different things. It often works well when we're feeling kind of anxious or nervous, just kind of like anticipating things coming. So feel free to apply them to other situations as well. All right, so that's it for this episode. Behavioral strategies are return your focus to a task that's in the present, and the cognitive strategies are to play through what you're feeling nervous about. And I have those 3 questions to ask yourself in the notes below, as well as a couple of links to be able to maybe find a therapist of your own. I hope you have a great rest of your day.